Educational GMAT. Your partner in your GMAT journey.
Let's start with the questions now. A very tricky one. So I'm not showing the answer choices right now because I just want you guys to focus on the argument for now. Done reading? Done reading? Okay, all right. What is the current rate of wrong diagnosis? 20%. Okay. And there is a newly developed internal scan. So that 20 has come down to how much? That's wonderful, right? That's wonderful. In fact, like it's a magnitude of 10 improvement, correct? Okay. However, again, as we discussed earlier, 20 has not come down to 0, right? There are still some imperfections that we have to live with. Imperfection in this case is misdiagnosis, correct? What would you say is the nature of the imperfection? Very nice. So what would false positive be, Tanishka, here? What does false positive mean? Excellent. So these imperfections, right? So let's actually write these down first of all. It could be either false positive. So false positive would mean that person does not have appendicitis, but test says he does. That's false positive. What could be the second next imperfection? False negative. Very nice. So false negative would be that the person does have appendicitis, but test says, what does the test say? Yeah, test says no appendicitis. All right. And what is the sum total of these two imperfections for the new scan? 2, right? So we have 2 misdiagnoses, which obviously misdiagnosis could be either false positive or false negative. Are we clear so far? Okay. Now read the last sentence. Clearly using this test means this newly developed internal scan, doctors can largely avoid unnecessary removals of the appendix without, however, performing any fewer necessary ones than before, since, and these are the answer choices. Yes, guys. Yes. David. All right.
Alpha.
Alpha. What do you guys think? Alpha, David? Sorry, David. Okay. Okay. What's the goal? What's the goal? Yes, yes. But what's the goal? Clearly using this test, what's the goal?
We will do whatever
Doctors can largely avoid unnecessary removals of the appendix. Now, unnecessary removal was being performed earlier in how many cases? 20%, right? 20% was unnecessary. So now the goal here is that doctors can largely avoid unnecessary removals of the appendix without what? Now this is important. Without what?
missing out the positive ones.
Without performing any fewer necessary ones. Fewer necessary ones. What does this mean, guys, in simple language? Without without performing any fewer necessary ones than before. What does this mean? Yes. So now my question to you would be that they are using this newly developed internal scan, correct? Tell me, using this newly developed internal scan, when will it be the case? Now hear me out. When will it be the case that the surgery was necessary but still not performed? Did you get my question? Using the, because now they are, actually that's another thing, right? They are now no longer dependent on symptoms. They will go with whatever the scan is showing, the newly developed scan, correct? Now, my question is, with the newly developed scan, when would this be the case that the surgery was necessary but still not performed?
False negatives. If those two are false negative.
Sorry, right, false negative. If this scan gives a false negative, what does false negative mean? What does false negative mean? That the person does have appendix, and since the person has appendix, which means the surgery is necessary. But since it's a false negative, the test says there is no appendicitis. So which means while the surgery was necessary, but it would still not be performed. Are you guys with me? Now, this is a case that they want to eliminate. Because if a surgery is necessary, then it must be performed. Correct? So, in other words, to accomplish this goal, what goal are we talking about? That if a surgery is necessary, it must be performed. So, it should never be the case that the surgery is necessary, but still no surgery is performed. This should not happen. But when will this not happen? When will this not be happen? When will this not happen?
And the false negative has another cause.
Then false negative should be how many?
0.
0, absolutely. There should be no false negatives. See, if any false negative greater than 0 would mean that there will be a person for whom surgery was necessary but still not performed. Guys, are you with me? Right? So to accomplish this goal, without performing any fewer necessary ones than before. To accomplish this goal, false negative must be 0, right? So in other words, both these instances of misdiagnosis have to be only and only what? Absolutely. Both these instances of misdiagnosis using this newly developed internal scan have to be false positive only. Are we clear? And that's where Baker is the right answer. The misdiagnosis produced, which is this, right? Misdiagnosis by this test are always what? Instances of attributing appendicitis to someone who does not, in fact, have it. Attributing appendicitis to someone who does not, in fact, have it, false positive. So both these misdiagnoses have to be false positive. That's what Baker is saying. All right. In fact, actually, I was surprised with Alpha and David because generally it's between Baker and Charlie. Why do you guys think Charlie is not the right answer, by the way? C?
It tells that there is no false positive also.
Okay, very nice. All the patients who are diagnosed with this test as having appendicitis do in fact have appendicitis. So what is this saying? It's basically saying that false positive is 0. So if false positive is 0, then it's essentially saying that both the misdiagnoses are false negative. We don't want that. In fact, we want opposite of that. Clear, guys? All right.
Can you see alpha once?
Alpha, okay. The patients who are correctly diagnosed with this test as not having appendicitis invariably have medical seriousness is not really being out of scope, right, Bharat?
Okay.
How serious? Yeah.
Like I was thinking that.
Sorry, Kunal, can you repeat? Can you repeat? Huh. Hmm. Because the other symptoms also indicate surgery would be necessary. It will not be, every patient who is diagnosed with this test has as having appendicitis has more than one of the symptoms generally associated with, but they would not be going ahead with symptoms at all, right, Kunal? That's the point. Which are cases are present. For example, it says they have. One second. The test says they okay, but they actually don't. Okay. But what I'm saying is that doctors would not be going ahead with symptoms at all, right? They are just banking on. Yes, absolutely. There's no symptom here. Symptom, in fact, was earlier, right? When they were 20 misdiagnoses. Now they've completely switched, changed. There is no symptomatic treatment at all, whatever the test says.
Sir?
Yeah, Bharat, tell me.
So like our goal is to make sure that if the test is telling negative, the person should not have appendicitis, no?
Our goal is what, sorry?
If the test is telling negative, then the person should not have appendicitis.
Yes. If the test is saying negative, then the person should not have appendicitis.
In A, they are telling that if the patient is diagnosed as not having appendicitis,
correctly diagnosed with this test as not having appendicitis. Okay, correctly diagnosed. Yes.
he will invariably have medical condition much less serious than appendicitis. So he's not having appendicitis.
But medical conditions that are less serious, I mean, I'm just saying that what does seriousness have to do with this?
Okay, sir, but it is telling that he doesn't have appendicitis. Now, invariably, he doesn't have appendicitis means false negative is 0.
No, this is saying only for those patients who are correctly diagnosed. But what about patients who are incorrectly diagnosed?
Sir, if correctly is removed, then we can consider this option.